Weather can play a big part in our health, and as we suffer through the heat of summer, a reminder that not taking precaution can have serious consequences. Dr. Jessica Mason has more on how to avoid that trouble. And today we are talking about heat stroke. It's just that time of year again where people kind of forget that the weather really can play a part in our health. What do you normally tell people?
Well, as the weather is warming up, a couple of things. The first thing is prevention. We don't want to even get to heat illness in the first place. So you want to make sure to stay hydrated, be able to get yourself cooled off, stay in the shade or go indoors when possible. And of course, never, ever, ever leave a child or a pet or anyone for that matter in a hot car or in any car with the doors and windows shut.
Because we kind of forget that those areas can really heat up to dangerous levels. It doesn't have to be that hot.
It doesn't. It could be just a warm day, but in a car where the heat's coming in and warming up the car and then can't escape, the inside of a car can get way hotter even on just a warm day, and it can cause heat illness and heat stroke.
Who is most at risk for this?
The at-risk populations are young children, by far, little babies. The elderly are also at high risk, and anyone with any underlying medical conditions are also at risk. Also, people who are on medications like diuretics, where you're already kind of losing some of your hydration status, are also at risk.
And what are the symptoms that we should be looking out for?
On the mild end of the spectrum, you can get things like feeling dizzy, maybe getting a little bit of a headache. You can get some swelling. Some people will even pass out. And then those should be the signs that you need to cool yourself down, get somewhere cool, get hydrated. Because if you don't, it can progress to heat stroke, where you can get confusion and headaches, seizures, loss of consciousness, and that's actually an actual stroke. That's causing brain damage at that point.
So if we get to that point, what do we need to do?
Someone needs to call EMS and get them to an ER so we can intervene and do all of the medical therapies to cool that patient down as quickly as possible. Another thing that you can do, if let's just say you're out and someone's feeling some of these symptoms that we talked about, how do you cool them down other than just giving them water? You could spray some water or put some water on their skin, and it doesn't even have to be cold water, just tepid water. And the evaporative cooling will help cool them down really effectively.
So, but again, we go back to just the prevention. We need to make sure we cool ourselves down before we ever get to that point.
Yes, and if you're going to be out somewhere hot, bring lots of fluids with you. Water's the best. Gatorade or dilute Gatorade is really good. And if you have one of those spray bottles that you can spray yourself and fan yourself, that's also very effective.
All right, good advice. As always, Dr. Mason, thank you so much.
Thank you.